Dear audience, I'm not very interested in CSR. I'll be very brief in that. But let's say the CSR, the current treatment strategies we have, the first line of management is observation only, nothing to do, or medical intervention like anticorticosteroids and aspirin, anti-H. pylori, all that stuff, anticholinergics, maybe surgery to close the leaking point by laser, by photodynamic therapy, or by subthreshold laser. But suppose I had discovered a treatment, and this treatment with a very surprising primary results. These primary results that all the patients received this treatment showed very excellent results. All of them showed anatomical, functional improvement within 1 month by single oral dose. Now what to do to prove the efficacy of this my new treatment? Well, first of all, to start the treatment, I have to prove two things: the efficacy and the safety. The efficacy is mandatory before any treatment and surgical procedure, and this is by case control studies, and the safety need a coherent studies to detect the safety. It's not very enough to say I think it works. Although we have a very widespread public professionals that say this treatment is effective, so it's not very enough. I had very scientific objections. This is not enough. So this is called anecdotal report. Public belief of efficacy is anecdotal report. I have to pass in what's called case control study. But the case control study, I have to have two groups. One group receiving the treatment, the other is not. But this would disclose the association, not the causality. The association means it may resolve by itself without any treatment. You know, CSR sometimes and usually resolved without any treatment, so may be related to only the relief of the stress. So to overcome this problem, I have to put a placebo, to put some sort of treatment which is false treatment. And in this case, this is called case control study with the placebo. But now I can manipulate the study. In this case, I would choose these cases, enrolled cases. And in this case, I would pass in what's called confirmation bias. To overcome this bias, I have to pass in what's called randomization of cases. And the randomization of cases, in this case, I would pass in an age-matched cases, which is different from my own selection. But this still is not enough. I have to pass in what's called double mask. I have to be not aware of my own cases and the controls. And this is case called double masked control placebo. So in this case, would be the scientific approach, and my treatment now proved to be not effective, unfortunately, and we will continue to search another treatment protocol. And this ladder shows the strength of the studies that we would pass in. So anecdotal report is not very enough for our belief. Then we pass in case control study. I would mask the patient with a placebo, then mask myself with a double mask study, and in more reasonable and more scientific approach. And thank you.